Because what I notice when you are sensitive in some areas, I
Yes.
think we have to calm things down around the scars a little bit.
Okay.
Because what happens sometimes is that the nerve endings get caught in the scar tissue.
Okay.
And nerves don't stretch. They are like very strong. They have this casing that's very strong and very firm, and that doesn't stretch at all. And so when being pulled on, the body wants to protect the spinal cord because that goes directly in the brain. So that is why you say your shoulders tense, because everything wants to hold it before it pulls all the way into the spinal cord. So you have these sensations for good reason.
Okay.
So we have to work together. You just lift your hand before you have to flinch. So this has nothing to do with Rolfing much, but the way we teach these days, we say it's a spectrum of touch. So I like my students to be able to do deep work, but slowly. Because when we go little bit by little bit and we observe our clients, we see how they breathe. So I just saw you took a deeper breath into your chest, and it was a little sudden. So then I know, okay, I have to watch out. Just go a little slower. Yeah, good, nice. And what my fingers are doing, they're exploring for what we call the layer of availability. So at first I'm just on the skin. And then you notice my other hand, this one is not really working, just holding, but it kind of pulls on the skin.
I can feel it.
Yeah, exactly. And then where the scar is, I can pull a little bit on the scar so that the hand that's working here can pull on the other side really close to the scar. And then I see, okay, does the skin layer move on top of the next layer? In the hand, that's very thin. In other areas where it's fleshier, that's easy to move.
That one's not.
And so I just want to see, okay, does this scar allow us to move a little bit more? Because the nerves always go between layers, and we have to allow them to have space there. Good. That's already easier.
Yes.
And now, your breathing goes a little easier, but I also notice your nervous system is still, oh, what's she gonna do, you know?
Yeah, I'm trying to relax.
So your brain is trusting me, but not your whole system.
Okay.
So you don't have to force yourself to trust me, because you just met me. You shouldn't trust me yet. Good. So we take a little break.